Wow. It really makes you want to go out there and punch a Russian, doesn't it? Ray, go. Oh, there you go. I'm sorry. What do we have in the book, Ray? I know it's top 20. 14, 15? 18, okay. We put that as the 18th best movie, sports movie ever made. A couple of notes, and Ray wrote this chapter, he can speak better than I can. One of the interesting things about that movie when they cast it is rather than cast actors and try to teach them to play hockey, they cast hockey players and taught them how to act, because it was very important to get the sports scenes right or the whole thing didn't work. And one of the actors in the movie, you know, the crowd gets younger and younger. I don't know how many of you remember the 1980 Olympics. I remember it very well. But there was a player on the team named Buzz Schneider. And the actor in the movie who plays Buzz Schneider is actually Buzz Schneider's son, who was a college hockey player and got cast playing.
Al could probably speak to some of the technical aspects of this very well, but of all the sports movies, and one of the things that we graded all sports movies on was how authentic they were and how good the action was. And hockey may be the toughest action to film for a movie because it moves so fast. But I thought they did an exceptional job, and as Glenn said, casting real hockey players to play the kids on the team, I think was very smart because the action looked very, very real. And Kurt Russell's depiction of Herb Brooks is absolutely spot on. I mean, he really captures everything that Herb Brooks was about. So this was really a good movie. Glenn and I both liked it. Frankly, I didn't have high hopes for it. I thought there's no element of surprise here. We all know how this is going to wind up. But boy, I'll tell you, when they played that game in the movie, you were on the edge of your seat. It was really, really well done, and we absolutely felt like we had to put it in the top 20. Yes, Al?
Thanks, guys. I'm only here for the hockey movie. I grew up with most of the guys from Massachusetts, and in that movie, the rivalry between Massachusetts and Minnesota was real. They had big, tall, blonde guys with big teeth, and I remember playing them as a kid and thinking, oh, we're never going to get along with them. I don't like them, and he did a great job doing that. And I was a better player than Eruzione.
Al Morganti and I actually went to college together. And Mike Eruzione was there, we were there, Jimmy Craig was there when we were there, and yeah, Callahan was there, a couple of the others, and Al was better than all of them. It was Al's personality that kept him on.
2 seconds.
All right, our next doctor, by the way, any questions on that? We'll talk questions at the end, but if anybody has any questions or comments you want to throw out, just raise your hand and we'll find you. And as Ray said, we do have copies of the book that we are selling tonight. They're $20, and $5 from each sale goes to, I forget the Cooper charity.
Cooper Foundation.
Cooper Foundation charity. So if you buy a book, you'll enjoy it. Ray and I will sign it, and $5 of it goes to the charity. Okay. Dr. Chistian Squillante, I don't know if you can get the feedback. Dr. Chistian Squillante is the attending physician and associate program director for administration in the Division of Hematology and Medical Oncology at MD Anderson Cancer Center at Cooper. He is going to talk a little bit tonight about, again, men's health issues, prostate cancer, and particular issues to men. So Dr. Squillante, here we go. I understand he doesn't have the fan club, perhaps, of our first doctor, but, you know, well worth it.
Thanks, guys. So I just want to start off and let everyone know I'm not a high schooler dressed up as a doctor. I'm actually old enough to be doing this. So I'm one of the oncologists at Cooper, so with that, my specialty is in cancer medicine. You know, I was thinking about 40 years ago when my parents were kids. They told me when I was going into oncology that they didn't know many people who had cancer growing up. But I think nowadays, looking through this room, there's probably not many people in here who can say they don't know someone who's been affected by cancer. And that's because we're not only finding more cancers, but some cancers are becoming more common for a lot of reasons we don't always understand. But I want to talk a little bit about what we can do to help prevent cancer and what you can do to make yourself a little bit healthier from a cancer standpoint. You know, there's things we can't change, and I think all of us up here are going to talk about our respective fields and what we can't do differently. You can't change your genetics. You can't change your family history. You can't change your age. And you can't change your race. And these are all things that for different cancers can increase your risk. But what you can do is change the fact that you go to a primary care doctor regularly and get regular checkups, because some cancers are in fact preventable and curable if caught at an early stage. If you like to suntan, be out in the sun, be down at the Jersey Shore, down the shore all summer, you should be getting skin checks at least once a year, so you should be seeing your dermatologist. How many people in here are over 50? All right, and I'm going to assume now that every single person who raised their hand has had a colonoscopy, right? Yes, because that's the next thing that you should be doing. You should be getting colonoscopy screenings. These are really important. You don't have to die of colon cancer if it's found early, so you should be getting that checked. If you've been smoking, it's not too late to stop. Stopping reduces your risk of smoking disease and lung cancer almost immediately. And if you've been smoking for a long time, we actually have found out now that we can actually screen for lung cancer in some cases. So if you've been smoking for over 30 years and you're over 55 years old, you should get checked for that. You can also talk to your primary about that. And then everyone's favorite, prostate cancer. Yes, you love going to the doctor to get screened for prostate cancer. You know, there's a lot of controversy lately about getting screening for prostate cancer done. The government came out a couple of years ago and said we shouldn't be doing it because people get harmed by prostate cancer screening. And in some cases that is in fact true, but at the end of the day it needs to be a conversation between you and your doctor about whether it's right for you based upon your individual risk. If you have a family history of prostate cancer, are getting older, or are African American, you are at a higher risk than the general population. If you have symptoms like blood in the urine or difficulty going to the bathroom, it's something you should get checked out. So there's not a lot we can do to prevent some cancers, but we can get screened and prevent others. And I just wanted to leave you with one more piece of information, which I think will make all the men in this room very, very happy. Kids might want to cover their ears for this one. A major study came out of Harvard actually of about 30,000 men that showed if you have over 21 orgasms a month, your risk of prostate cancer goes down by 1/3. So, come on. That's the best news I can give you. And give yourselves a hand.
Doctor, can I give you my wife's cell phone number? Did you have a question, or you were still raising your hand about the number of orgasms? No.
Thank you, gentlemen, all for having this seminar. I'm 11 years survivor. I was treated across the river. And I was wondering if Cooper has anything like a buddy system that they have over there. It's a wonderful thing. In fact, I'm involved with the hospital and the Cleveland.
That's a really good question. But explain a little bit, just quickly, if you could, what the buddy system is.
So there's two aspects to that. So one, there is a survivorship program because as we've had more and more survivors of cancer through advanced techniques, we've learned that sometimes there's complications and long-term consequences that have to be monitored for, including heart health and overall well-being. So we do like to follow survivors long-term, and we do have a survivorship clinic for that. And you know, sometimes it's helpful to be paired up with someone who's been similarly diagnosed with the cancer that you've had, who can walk you through what their treatments, what their experience were like. And this is actually supported by the national cancer organizations to connect current cancer diagnoses with survivors or people currently undergoing treatment. So you can definitely reach out to your primary care physician or oncologist.
Good stuff. Thank you very much. I'm telling you, that number 21 is going to stick with me. All right. Our next movie, everybody here know the story of Vince Papale? Okay. Do you know who was the first guy to write that story and the guy who gave Vince Papale the nickname Invincible? He's right here. Ray why don't you introduce this one?
Well, it is true that I gave Vince the nickname Invincible. The day that he made the team, when they made the final squad cut, and he was officially on the team, I was still writing for the Philadelphia Bulletin at the time. And I went back to the office, and Vince's pursuit of a spot on this team was an ongoing story that went through the whole summer. And everybody was rooting for him to make it, because he was a remarkable story. A 30-year-old rookie, never played college football, trying to make it on an NFL roster for his hometown team. It was a great story, and we all kind of wanted to see it happen for him. And on the final day, when Dick Vermeil cut the squad, and it was for sure that Vince was on the team, I went back to the office to write the story, and the editor was sitting at the desk, and he said, okay, we're going to lead the section with this story about Vince making the team. He said, do you have any suggestions for what we should put in the headline? And I said, why don't you call him Invincible? And he said, that's a good idea. So that became the headline for the story. And then it became a running thing with Vince and I, that forevermore after that, I would always call him Invincible. And so years later, when Disney Pictures picked up the idea of his story and made it into a movie, he called me from California, literally from the studios of Disney, to say, the deal's been signed, the movie's going to be made, and you're never going to guess what the title of the film is. And I said, I have no idea. He said, they're going to call it Invincible. And then I said, wow, well, what's my percentage? And the phone went dead at that point. But I was thrilled for Vince. He's a great, great guy. And obviously, this movie changed his life, because ever since then, he's made a very nice living as a motivational speaker. But we chose Invincible for the book. It obviously had to be in the book somewhere. And they're going to show you a film clip here. This is going to be the Eagles-Giants game, Week 2, 1976 season. It was filmed actually at Franklin Field, but they digitally made it look like Veterans Stadium. Pretty neat trick. And one of the things you'll see is they got the Eagles uniforms of 1976, absolutely identical, all the way down to the Liberty Bell logo that was stitched onto the sleeve. So this is a scene from Invincible, with obviously Mark Wahlberg playing the part of Vince Papale.